President Trump and congressional Republicans don't seem to care if families like mine are unable to afford health insurance.
All right. Anyhow, as everybody knows, we are now in a government shutdown. Republicans are attacking Alexandria, attacking me. Why didn't you vote for this clean CR to keep the government?
The United States government has shut down, and I'm a doctor, so what does that mean for medical practice? Federal programs like the FDA, CDC, and NIH will be shut down. FDA is in charge of drug regulation. CDC is in charge of infectious disease and spread across the United States. So if there's, for example, an E. coli outbreak in an area, the CDC is in charge of investigating and issuing alerts and warnings about this and spreading awareness and taking action to resolve it. The NIH is the main federal government body that allows for research funding. And so related research projects like cancer research, especially at big academic centers, will be held. Medicare and Medicaid, the two government health insurance programs, will be delayed in their prior authorization approvals. Prior authorization is basically asking these insurance companies permission to get access to a medication, especially if it's expensive or more advanced, or being able to have surgery. Say your doctor says you need to have surgery because you have a cancer. You need the prior authorization for this to occur in some circumstances, and with the government shutdown, these prior authorizations will likely be delayed. Depends on how long the shutdown is, we don't really know, but I am worried about a backlog once the shutdown is resolved on all the prior authorizations submitted, kind of getting through that in a timely manner. Obviously, if your doctor recommends a medication and surgery, you want to have access to that as soon as possible, right? I already mentioned in a previous video, there will be strict regulations of Medicare with telemedicine coverage. Telemedicine is great for patients that have Medicare because Medicare patients are oftentimes elderly with mobility restrictions. There are also patients that live in very remote areas that are very far away from hospitals and doctors' offices. And Medicare also covers some disabled patients like those with end-stage renal disease. And so you can understand that these limited patients will have a hard time connecting with their doctor if they don't have access to telemedicine. Now, telemedicine is not entirely out of the question for Medicare patients. I mentioned in a previous video, it will still cover end-stage renal disease, psychiatric disorders, mental health counseling. There's an acute stroke rule out with the mobile stroke units, but outside of that, no. Your doctors and healthcare teams will always try their hardest to continue high quality continuity of care no matter what is happening in the world. But I do think it's a little important to stay up to date with the times and know what you have access to and know what you might need help with.
The attack on healthcare just escalated. In the last week, 100% tariffs were put on prescription drugs for companies that haven't broken ground on manufacturing here in the U.S. Insurance companies are routinely denying claims for treatments for things like MRIs, CAT scans, and just normal solutions that your doctor prescribes. Even surgeries and necessary cancer treatments are being denied. Copays, deductibles, out-of-pocket expenses have gone through the roof. You've got to be worried about it. I know my family is. And the government shutdown, what the Democrats are fighting right now is to change what they're talking about with the ACA, marketplace insurance, because they're trying to get rid of it. This is all in Project 2025. If you don't believe me, go look it up. They want to do away with Obama-era marketplace insurance plans, and all subsidies will disappear. It's going to make insurance unaffordable to a large part of the population. Insurance companies don't want the regulations. Remember before Obamacare, they were able to deny you insurance coverage based on pre-existing conditions? That was all wrapped up in the ACA stuff. That goes away at the end of 2025. So what do you think is going to happen with these private insurance companies that are owned mostly by private equity? You think they're going to continue to cover? No, they're out to make money. That's all they really, really care about. I see a lot of people talking about buying catastrophic insurance and then paying out of pocket cash to do normal stuff. That's not doable for people with chronic illness. That's not doable for people that are low income. There's a big problem, and 2026, we're going to see major healthcare crash. America is the only wealthy nation that does not offer universal health care to their citizens, and now they want to privatize it more. It's wrong. Go read my blog, follow my Substack or my blog on my website, bernadettegold.com, and you can learn about taking control of your health, because being healthy is a sacred form of protest, especially today.
ICE is the current biggest threat to our healthcare system. Let me explain. Whenever you see ICE at hospitals, I want you to remember that their $30 billion per year budget was only made possible by kicking 15 million Americans off of their health insurance plans and putting rural hospitals everywhere at risk of closure. These are your tax dollars in action, and they could have been used to help make people's lives better, to help make our healthcare infrastructure stronger. Instead, they're being used to forcefully disappear your neighbors and rip families apart. My job as a nurse is really simple. Put people's well-beings first. And that means every single patient that comes through my doors should be able to access the healthcare that they need, have their privacy protected, and be treated with dignity. But now, instead of focusing on treatment, families are afraid of getting separated. Instead of trust, there is fear. And that interferes with my job. That interferes with our job. It puts a barrier between providers and patients, and sometimes it makes people avoid seeking help altogether. Healthcare should never be accompanied by the fear of persecution. It should be about healing. Hospitals have to remain a safe place where people can go and seek care without the fear of ICE kidnapping them looming over their heads. This administration is gutting our healthcare infrastructure, and now is the time to stand up for one another. As healthcare professionals, helping this administration facilitate ICE raids would destroy the oath that we took to our communities. If you want to learn more about how you can protect that oath, visit the National Immigration Law Center, or the NILC.
Vice President J.D. Vance just gave the clearest explanation that I've heard yet as to how it is the Democrats were trying to push forward health care for illegal immigrants paid for by American citizens to avoid the shutdown.
This is a Democrat talking point. They say we're not actually trying to give health care benefits to illegal aliens, and here's why it's not true. There are two Biden-era programs that explicitly gave the taxpayer health care money to illegal aliens that we turned off when President Trump took over in January. Program number one is there's a lot of emergency health care at hospitals that are provided to illegal aliens. That was funded by the federal government. We turned off that funding because, of course, we want American citizens to benefit from those hospital services, not to be taxed and then to have those hospital services go to illegal aliens. The second of which is the Biden administration gave mass parole to millions upon millions of illegal aliens, and then they simultaneously made those parolees eligible for health care benefits funded by taxpayers. In the One Big Beautiful Bill, President Trump and congressional Republicans turned off that money to health care funding for illegal aliens. The Democrats want to turn it back on. And in their initial proposal, the first thing that they put out to reopen the government, they actually turned that money for health care benefits for illegal aliens back on. So it's not something that we made up. It's not a talking point. It is in the text of the bill that they initially gave to us to reopen the government. It's preposterous for them to run away from it now. But look, let's set that all to the side. Let's open up the government. Let's negotiate on all of these healthcare policy issues. Obviously, we're not going to support healthcare benefits for illegal aliens, but we will work with them to lower healthcare costs for American citizens if they're willing to do so.
For all you liberals and leftists who are going to try to say Republicans own the House and the Senate and the presidency, this is their fault. And you obviously don't know how it works when it comes to passing spending bills. Because when it comes to spending bills, you need 60 of the senators to agree with it in order for it to be passed. So the Democrats are trying to use their minority to force through or repeal things that were done during the One Big Beautiful Bill. We only need 7 Democrats or independents to cross the aisle to pass the continuing resolution that Republicans already passed through the House so that they can debate these other issues on Congress's time while keeping the government open. I guess it really is a Schumer shutdown, huh?
Okay, I'm just gonna come out and say it. If you see me having a panic attack in the wild, please know it is Blue Cross, Blue Shield, it is their fault. Because I'm in a full crash out right now. Last year, me and my husband switched our healthcare plan at his work to a much more expensive plan because it had lower deductibles, lower out-of-pocket maximum, and then overall better care for pregnancy. And we anticipated we might get pregnant at some point this year, which is why we switched into that plan that literally cost us several hundred more dollars per month to have. Anyways, we get pregnant in July. Great. We have great healthcare coverage, or so I thought. I am 18 weeks pregnant. I have had 4 appointments so far. And every single one of my claims from those appointments has been denied. Every single one. So now my doctor's office is saying I owe over $1,900 worth of care that under our plan, prenatal care is 100% covered. So why the frick am I getting billed $1,900 for care that is supposed to be 100% covered? And I am perfectly healthy. Like, I'm not seeing any specialists. I'm not seeing an MFM. What we know about our pregnancy so far, the fetus is perfectly healthy. I'm not getting specialized tests. Everything is routine care. So why am I being charged $1,900? So I called billing office at my doctor's office and I'm like, am I missing something? Is the office out of network? Are the doctors out of network? No. Office is in network. All the doctors and the providers at that office are in network. So I'm like, okay, was everything coded correctly? Like, why am I still being billed this? And mind you, this took like a few calls just to figure out that little bit of information. And they come back with, oh, your insurance got denied because the agency claims that they need more information for you. So naturally, my next call is to the insurance agency. We call them. We're like, hey, why are these claims being denied? They're like, oh, since you're under your husband's healthcare plan, like, we need to know that you don't have insurance elsewhere before we make coverage. No, I don't have insurance elsewhere. So we say that, like, oh, we don't have insurance anywhere else. They're like, okay, we'll get the claims resubmitted. It has been weeks. And I am still getting text reminders from my doctor's office reminding me of my overdue balance. I'm getting letters that are emailed to me saying, oh, do you want to sign up for a payment plan? No, I do not want to sign up for a payment plan for something that's supposed to be 100% covered with my insurance. I have wasted so many of my lunches on the phone with robots waiting to speak to actual people to understand why this is not being covered. It has been so many weeks and months even from like the first bills trying to get this figured out, and we have made like literally zero traction. It's driving me up a wall. Like, why am I paying several $100s a month to have coverage, just to have the coverage, and then I have to jump through 10 flaming fire hoops just to get what is included in that plan actually covered? It makes no sense. I don't know. Like I said, if you see me having a panic attack, that is why.
Here we go. For months, Democrats have been telling the American people, we're not trying to give health care to non-citizens. Really? Then explain this. Right here in the bill text, section 71109, alien Medicaid eligibility, Democrats slipped in language to repeal protections from the OBB bill and restore healthcare benefits for non-citizens. It includes people here temporarily on visas, people under parole programs, or special carve-outs like Cuban and Haitian entrants. These are not U.S. citizens. They're not permanent, and yet Democrats tried to make them eligible for Medicaid, a program that should be focused on American citizens who actually pay into the system. So next time the left says, nobody is giving free healthcare to illegals, remember this video. They tried to sneak it through and they got caught. Meanwhile, U.S. citizens are facing 30 to 50% premium hikes. Democrats want you to pay more so non-citizens can get coverage. Thank you, Trump and the GOP, for fighting to protect Americans' healthcare. Have a great day, Patriots.
Here's what you need to know about this government shutdown. Healthcare edition. Y'all, they're going to cave. Whether you like it or not, the minority party in this country will cave in order for this government to be funded. Now, I think it's noble of them really want to fight for the social programming in this country, for them to stand up and say, I want to protect Medicare and Medicaid, and I want to make sure that they're funded. And I think it's noble that they're trying to use that as leverage to really push the majority political party to really hear them out. However, the majority party only need 8 of the minority party, which is the Democrats, to fund the government. Once with a minority party or the Democrats start hearing from their constituents who are impacted by the government shutdown, who are going to be losing a lot of things because of the government being shut down, it is going to put them in a situation where they're going to have to sadly give in to the majority political party, which is right now the Republicans. But if you are working in healthcare like me, we were never going to win. It was never going to work in our favor. And it doesn't matter whether the government is funded or not. We lost when the majority party, the Republicans, put in those extensive cuts into Medicare and Medicaid. And we are going to lose when the minority party caves in. We'll still have to accept the cuts to Medicare and Medicaid, even if they are reduced by a small, like 10, 20%. We have already lost. It's not going to ever be a situation where Medicare and Medicaid will be off the table here. And that's what people in healthcare need to understand, which I do believe we do. Healthcare in general is on the table. It's being cut up in slices, whether it's the H-1B visas, whether it's Medicare and Medicaid, or whether it's our research. We are no longer going to be a safe place that's no longer touched by our government, unfortunately. But if you have any thoughts, leave it down below. Love to hear what you think.
Well, there it is. Today's Republican Party genuinely does not care whether or not you have health care. Watch.
Are you in favor of extending the COVID Obama subsidy or the subsidies for Obamacare?
I'm not. You look at this was always meant to be a temporary emergency COVID era subsidy. It's a $350 billion price tag, and it is absolutely rife with fraud, waste, and abuse. And
oh, look at that. Suddenly Republicans are worried about the cost. $350 billion. Know how much Trump's tax cuts in the One Big Beautiful Bill Act, the ones that go almost completely to the richest people in America, you know how much those are going to cost us over the next 10 years? $4.5 trillion. Trillion with a T. Now you may say, wait a minute, why wasn't I aware that it was going to add all that much money to the deficit? Well, because Republicans used an accounting trick when they were extending the rich people tax cuts. They used something called the current policy baseline to make it look like the tax cuts cost nothing, because they knew they had to get them through, but that Americans would be pissed if they knew how much they cost. Sadly, they have no such urgency when it comes to lowering middle-class Americans' healthcare costs. They don't want to use that accounting trick. They want to highlight the cost this time. By the way, a fun factoid that you should know, more than 90% of the people on the ACA make less than $63,000 a year. Exactly the kinds of people the Republicans have no interest in helping, but they are interested in, let's see, bailing out Argentina for $20 billion, sending U.S. military into cities even though they're not wanted or needed, upgrading a Qatari jet for Trump, that's going to cost $1 billion. And wow, let's not even get into how much Pete Hegseth's little man stunt with the military cost us. As for the so-called waste, fraud, and abuse, we know that that's just a phrase Republicans break out when they want to cut things that help Americans. Oh, and by the way, there is no actual evidence of rampant fraud in the ACA. Just FYI. Not to mention, if Republicans really cared about that, why are they letting all the rich tax cheats get off? Because they think rich people should get to keep all of their money. They just don't want you to have it. These premium increase letters are going to go out in the next few days, you guys. If you are on the Affordable Care Act, brace yourself. Because of the Republican Party, who own this shutdown, who own this tanking economy, and who own the healthcare crisis that we are in right now, you are going to see your premiums skyrocket. When you open that letter and you see that number, make sure that you have got your Republican lawmaker's phone number close to hand, and then you give them hell.
Hey everybody, I was walking here in Washington, D.C., and who did I bump into? One of my favorite members of the United States Congress, Alexandria Ocasio-Cortez.
And one of my favorite senators.
All right. Anyhow, as everybody knows, we are now in a government shutdown. Republicans are attacking Alexandria, attacking me. Why didn't you vote for this clean CR to keep the government open?
Well, there's nothing clean about it. This is one of the dirtiest tricks that is being pulled on the American people right now. Starting today, October 1st, and throughout the rest of the month, Americans across this country are going to start getting notifications that their insurance premiums are up to doubling. We're talking about...
Say that again.
Your monthly insurance premiums are going to double for millions of people across the country.
At a time when we are already paying, by far, the highest prices in the world for healthcare, at a time when people can't afford it right now. So what happens?
That means people getting bankrupt over chemotherapy, people going to the pharmacy and not being able to get their insulin. And frankly, it means a lot of Americans are going to be in danger. And Republicans want us to rubber stamp that. So what are we going to say to that, Bernie?
Well, I'll tell you, it's not only be in danger. Let's be clear. And doesn't make me happy to have to say this, but there have been studies out there that when you combine doubling premiums for the ACA and then throwing 15 million people off of Medicaid and the ACA, the result is, according to studies at Yale and the University of Pennsylvania, 50,000 low-income, working-class Americans will die every single year. All right? If you don't have the money to go to a doctor and you're sick, you die. And that's what we're looking at. That's what this clean bill is about.
And so Republicans want us to rubber stamp that. And we're saying no. We need to stand up for the American people. We need to stand up for our healthcare system. And if they want our votes, they need to make sure that we're protecting every American and making sure that we can do what we can to continue to make healthcare accessible, affordable, as we work to make it a human right for all.
Right. So let me just back that up. Remember, right now, our healthcare system is broken. Right now, we're the only major country on earth not to guarantee healthcare to all people. And these guys want to make it even worse. We're not going to let that happen.
No, we're not.
Thank you.
Just after midnight here in the United States Capitol, Donald Trump and his corrupt Republican cronies have officially shut down the federal government because of their unwillingness to protect the health care of the American people. Democrats are on duty, ready to sit down with anyone, anytime, and at any place in order to reopen the federal government and pass a spending agreement that meets the needs of the American people. But we don't have a credible partner right now. And we will not support a partisan Republican spending bill that guts the health care of the American people. Not now and not ever.
We all have to get behind the Democrats calling for a shutdown. And Trump supporters, I am talking to you too. We need the Affordable Care Act subsidies to become permanent. And over 50 conservative groups are urging Trump to let them expire. And let me tell you, this is one example of the math. A couple who are 55 years old, collectively bringing in $85,000 a year, currently pay, on average, in healthcare premiums, $7,500 a year. If these Affordable Care Act subsidies expire, their premium, are you listening to me, Trump supporters? Their premium jumps to $24,000 a year. So while the billionaire class continues to become ungodly wealthy under this administration, private healthcare insurers and all of their executives are going to make a shit ton of money because they'll get to charge you another $17,000 a year. Just a couple making $85,000 a year. A lot of us don't make that much. Who can afford to have 25% of their income go to health care premiums? We're just going to become uninsured. No one's going to be able to afford that. Are you ready for this, Trump supporters? Instead of owning the libs, can we not all get together and agree this is really, really, really bad and it's okay to jump sides one issue at a time? Can you do that to save yourselves? Please.
President Trump and congressional Republicans don't seem to care if families like mine are unable to afford health insurance. I live in Kentucky with my daughter and my husband. He's a computer programmer and I work for a nonprofit. He's a Republican and I'm a Democrat. We make that work. Last year, my husband got laid off. He was the primary breadwinner in our family, so that was a real blow. The worst thing was that we lost our health insurance because he had always carried that through his employer. Fortunately, however, we were able to buy insurance on our state's Affordable Care Act marketplace, but it was still really expensive. We would never have been able to afford it without the enhanced premium tax credits, which is a subsidy from the government, which makes insurance affordable for middle class families like mine. We're hoping we can scrape together enough money next year to afford health insurance, but we're already in a tight spot. My husband is still looking for work. I work a full-time job and 2 part-time jobs to make sure that we can keep our house and keep food on the table. My husband had a health scare last year. They found a tumor on his thyroid. His marketplace insurance paid for all the testing for us to find out whether or not he was okay. I am absolutely terrified that something like that's going to happen again next year, or my daughter's going to get sick and we're not going to have coverage. I'm really worried about this government shutdown. People are going to lose really vital services because of it. President Trump, please extend the ACA tax credits so that working families like mine have a shot at affording health insurance.
So guys, there is a shutdown that is looming in the government of America. I know most of you are like, what is shutdown? Okay, some of you, but I'll come later on and explain, guys. Or should we even start from there? Because that is very critical. By the time you hear that the government is shutting down, you know, it means a lot. It actually means a lot and a lot. So number one, the Republicans and the Democrats, they are not agreeing. They have refused to agree simply because one side is saying we want this, the other side is saying no. One side is saying cut taxes, the other side is saying raise them. So the confusion in between is causing a lot of problems. And you know, when they fight, it's the Americans, the citizens of Americans, who are going to suffer. And you imagine the government is this big team, and then on one side we have the Congress, on the other side we have on one side we have the Republicans, and on the other side we have the Democrats. And they have refused to agree because, you know, for the two parties, they normally sit down and they agree. They make a plan that we call a budget that is going to run America for the entire year. So after they make a plan, they need to sign it off. If they refuse to sign it off, like recently that's just what has happened in America, then there is a shutdown. So major parts of the government don't function actually. It doesn't function at all. And that means like government spaces, they are closed down. Government workers, they are at home. And also, I don't know if I'm audible enough. My battery had really gone down. So there was an issue with my microphone. It's actually almost powering off. So let's continue from where we left. Passport offices, there are a lot of delays, and some critical parts of the government will be functioning, like the hospitals, the military, but then there will be delay in payment because literally the government is not functioning. I mean, America of all countries, a developed country of all nations of the world, the superpowers of all. Hey, I never thought that such a kind of a story will ever come from America. We've known America to be this country that really plans themselves well. So there is a shutdown, and Americans have come out to speak boldly. So let's talk about Pope Leo has spoken for the first time since he got the position, and he talked about a very critical story, and that is about what Trump is doing and the administration, because he has actually touched on, you know, the story of the Trump administration deporting people forcefully, not willingly. You know, the Biden administration had a plan for these illegal immigrants. They really supported them financially. They supported them spiritually. They supported them socially. health-wise, and I mean, for the Catholics and for Pope, for the previous Pope, it was really humane that the government could really support these people that really needed help, because there is no way somebody can run away from their home and their home is doing okay, they are doing okay. They only get into these countries because they cannot afford to, number one, and because on the other hand, where they are coming from, it's very difficult. Things are getting worse, and now they go to America. They're forced to go to America illegally to fend for their families, for themselves, and to make their future to be better. In this Trump administration, a lot of people voted for Trump so that they can actually get rid of these people. When I say get rid, is to deport them. Now they are all crying. Everybody is crying, whether you voted for Trump or not. Everyone is crying because this tariff thing that Trump keeps introducing, the shutdown on programs that Trump keeps introducing, it's all affecting everybody. It's affecting everybody, whether you voted for him or not. It's affecting everybody, and that is why you are seeing farmers, doctors, teachers, they're really furious with this administration, because it seems like nothing is working at all. And you can see, I mean, there is a shutdown at the moment. So the Pope said that it would have been nice if he never chased these people away. Okay, deportation is just like chasing somebody, because they are going back with handcuffs. And of course, it's not good to inhumanly treat people like that. I watched a clip of somebody in America recently. There was an ICE raid, and this guy had a bicycle, and he was shouting, "I am in America illegally." And they chased him, like they really wanted him to be deported. So I wonder, what if he was caught? What would have happened to him? And if he was caught and they found out that he was an American, what would have happened? Or he was caught and found out that he wasn't an American? He would have gone through a lot because this guy was really daring. And you can also see the frustration in the faces of Americans when they see an ICE agent anywhere. When they see them anywhere, they chase them a lot. Like they kind of protest, and of course it's not good. So I wonder, why did people really vote for Trump anyway? But guys, according to Fox, Trump did the best. They came out and brought out this story of, these illegal immigrants. They were using the taxes of Americans. They were using scam programs. But now when Trump came in, before Trump came in, he promised to get rid of it. And guess what? He did it. I mean, this Fox channel, they are really proud of what they are doing, and they are in agreement with what Trump is doing. And I'm wondering, man, what's really happening, man? Anyway, guys, there are these Koreans that were deported from America sometime back, 475 of them. They really supported the economy of America and also back at home. And it was one of the biggest ICE raids, by the way, because it was all over the news. And guess what happened next? The government of Korea said that they are not going to do any other business with Americans, because they had actually invested 350 billion, and they were like, we are stopping this. Months later, Trump decides to bring these people back to work in these industries, because he noticed that nothing is going on. Without these Koreans, there is nothing that is happening. So I don't know what to think about all these stories, guys. Kindly comment down below. Let us know what you think.